If you've started vaginal dilator training and you're finding yourself wondering, am I doing this right? How deep should I put it in? How long should I do it for? How often? This video is for you. I'm Amanda Olson. I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist, and I'm here to answer all of your questions about dilator training. The first question that we get asked is, how deep should I place the dilator? And the answer is there's no magic depth. When you're using your vaginal dilator, you're looking for it to comfortably settle within the vaginal canal. Certainly, depth is often a goal for people that want pain-free penetration, but during the dilator training process, it is okay if you don't get the dilator in all the way on the first session or even the fourth or fifth session. You're looking for the dilator training to be no more than a 2 to a 4 out of 10 on the pain scale. So using plenty of lubricant, allowing the muscles to relax during the breath process, and inserting until you start to feel resistance, and then holding there is the way to go. Slowly but surely, you'll find that you're able to insert the dilator all the way. The next question I get asked most frequently is, how long should the dilator training session be? And the goal is roughly 10 to 20 minutes. The reason behind that time frame is because it's the amount of time it takes to train the vaginal tissue. So we call it low load, long duration hold, so that tissue gets more experience with growth and expansion and mobility. And it's also training the nervous system, the brain through the spinal cord all the way to the pelvic floor muscles to better tolerate something inside that vaginal canal. It's training your system that it's okay to have something inside and that it's not a threat. And eventually that will carry over to whatever your goals are. During that time, stay present, stay in your body, avoid scrolling on social media or on your phone. You can listen to music, and you're training your body day by day. The next question is, how often should I be doing my dilator sessions? And the best training response comes with daily practice, every day. If you're feeling sore after a training session or you're not feeling well, it's okay to take a day off. Try to avoid letting one day become multiple days, because the body is getting that trained response with experience using the dilator that's going to compound towards your goal. Eventually, when you do reach your goal, whether it's pain-free exam or penetrative intercourse, you can do upkeep of 2 to 3 times per week with your dilator. And there may come a day when you don't need your dilator at all. The next question is, how do I know when I'm ready to move from one dilator to the next? And the answer is, when you're able to comfortably maintain the dilator that you're working with during the complete session, then you are most likely ready to start progressing towards the next dilator. There's a few things that you can do to help train your body for that transition, and that includes inserting and removing the dilator, moving it from right to left and up and down, being gentle in the up position because that's where the urethra lives. But that's mobilizing the tissue and getting it used to more input with the size of your current dilator in service of moving towards the next. The other transition exercise is the clock method. So if you envision that the vaginal opening here is a clock, where 12 o'clock is the top part and 6 o'clock is the perineum, the bottom part, you can glide that dilator down and hold for 30 seconds to 2 minutes at 6, and then go to 7 and 8, all the way around with special care at 12 o'clock, just feather touch there because the urethra is there, just a little bit of input. But doing that will help you train the body to move from one dilator to the next. Another question that we get is, what if dilator training continues to be painful? While some soreness is to be expected when you're learning a new skill and you're training tissue, we would not expect you to be in significant amounts of pain day in, day out using your dilators. And if that is the case, that's a good time to check in with your physician or your treating pelvic therapist, because there could be other drivers of that pain. Just be sure to listen to your body. Some discomfort is normal when you're trying something new, but we don't want you to be in consistent pain. If you haven't yet watched our step-by-step guide on getting started with the vaginal dilators, be sure to visit that video in our YouTube channel, and we'll link that here. That video goes over breathing, how to set up your environment, and how to use the vaginal dilators, and it's the perfect place to start if you're brand new to using the dilator. The full set of Intimate Rose dilators is linked here in the description of the video, as well as our water-based lubricant, Serenity, which is the best formulated, safest ingredients to use with our medical-grade silicone dilator. Be sure to drop any other questions that you have here in the comment section, and I may turn your question into our next video.